certainly talking to a lot of our customers, a lot of them are dealing with the same issues, and we've talked about it. So many nurses and clinicians leaving the industry. Why do you think that is?
Oh, I mean, hands down, COVID. COVID wore everybody out, whatever your role was in the hospital, because everybody in the hospital played a part of taking care of patients, whether that was getting patients where they needed to be, moving them up and onward in the hospital or out the hospital, housekeeping, dietary, transport. Everybody had to multitask in their roles. And now the world has come back up, and I think as of May the 1st, I think officially we're out of the COVID pandemic. I think it's a global announcement. People are just burnt, they're fried, and we've become very more resourceful in the world, but unfortunately healthcare can't become as resourceful as the rest of the world. So for Improvada, for example, we can work remote. A lot of our roles we can do remotely. Now, we were successful remotely, but we also know that human touch, that interaction with healthcare is key to our success and key to making sure that we understand what our customers want, what the ask is, what the need is. So whereas in healthcare, there was nowhere to go. You never knew if you were leaving home in the evening. You never knew if day staff was coming on in the morning. And that just wears thin. It's almost like being in a bad relationship. There comes a point when the light bulb goes on and you're like, I'm out of here. So it's unfortunate. And that's the next, or actually now really has started, the next global pandemic. How are we going to staff healthcare? And particularly for my role of nursing, I mean, I send you articles all the time about nursing and how they're leaving and how so many data companies are doing trajectory numbers on what are we going to look like in 24, 25, 27, and comparing nursing school and just users not going in, people not wanting to join the career. Sad. I don't know where it's going to go. I don't know where it's going to end, but we're on a roller coaster to disaster.
And it's going to take innovation to get out of that, really.
Mm-hmm. Yep.
So on the technology side, how can good technology, secure, efficient access really help retain clinicians by reducing that burnout and improving their quality of life?
So, great question. Technology is our future, but I don't need technology to do my job. We come to work to save lives. Don't need the technology. But of course, the digital world is what we're moving into. Everybody loves to talk the buzzword, digital transformation. But what does that mean? That means digital technology, whatever it may be, is coming into healthcare. It's taking over businesses across the globe. But for me, it needs to be simple, accessible, efficient. And then I always say, if you make it efficient for me with any technology you give me, I'll make it secure. The efficiency is what equals security.
I think that's the difference. That's really going to help. Make a bigger difference than we realize.
Huge help. Mm-hmm. And anything that you can do to drive efficiencies for my role, my stressful role coming into the emergency department, I'll take on board. Has to be efficient, has to be user friendly, and I have to be able to access it in a timely fashion with no questions of how do I do this. It has to be intuitive.
Great. Really important stuff, Claire. Thanks so much for talking to me today. Appreciate it.
You're welcome.